Hello, and thank you so much for joining me today. My name is Melissa Devine, and I am one of the Medicare and Medicaid Assistance Program site coordinators here in Region 1B through the Area Agency on Aging. Today, we're going to discuss Medigap versus Medicare Advantage. So the topics we're going to discuss today are going to be the Medicare and Medicaid Assistance Program, or MAP. We're going to look at the background for Medicare, what Medigap is, how to buy a Medigap, why to buy a Medigap, and when to buy a Medigap, and Medicare Advantage. What is it? What do they cover? How to enroll? The pros and cons, and more. Let's get started with MAP. MAP counselors are certified and have been trained in healthcare benefit counseling. This includes Medicare, Medicaid, and other insurance products. MAP counselors are not connected with any insurance company, and they are not licensed to sell insurance. In many states, the MAP program is called the SHIP program, the State Health Insurance Program. Our program, again, is comprised of unbiased counselors located all across Michigan, offering free health benefit counseling assistance and outreach education. So what can a MAP counselor help you with? Well, a MAP counselor can help you understand Medicare health plans. They can help you compare and enroll in Medicare Advantage coverage, compare or enroll into Medicare prescription drug coverage, identify and report Medicare and Medicaid fraud and scams, and assist you with enrollment into low-income programs. Now let's take a look at Medicare. Medicare is health insurance for three groups of people: those that are 65 and older, those under 65 with certain disabilities, and those of any age with end-stage renal disease, or ESRD. It is administered through the Centers for Medicare and Medicaid Services, also known as CMS, but for enrollment, it takes place mostly through Social Security and through the Railroad Retirement Board for railroad retirees. There are four parts to Medicare. You've got Part A, hospital insurance, Part B, medical insurance, Part C, Medicare Advantage plans. Those are the HMOs and PPOs. And Part D, Medicare prescription drug coverage. So when you first enroll into Medicare, and of course during certain times of the year, you can choose how you would like to get your Medicare coverage. There's two main ways. The first way to get your Medicare coverage is through the first option here, Original Medicare. This means you're going to have your red, white, and blue Original Medicare ID card. You're going to have the coverage for your hospital and your medical through that. You'll elect to then purchase a standalone Medicare prescription drug plan, and then you can add, if you'd like, a Medigap policy, also known as Medicare Supplemental Insurance. These Medigap policies help pay your out-of-pocket costs in Original Medicare. They help fill in those gaps. Now, the second option is to purchase or enroll in a Medicare Advantage plan, also known as Part C. These are the HMOs or the PPOs. They're going to include coverage for hospital, Part A, medical, Part B, and prescription drug coverage for Part D. And some plans may even include extra benefits like dental, vision, and hearing. But they are going to be HMOs and PPOs through private insurance companies that are going to have their set networks of physicians. So now that we've taken a look at Medicare, let's take a look at Medigap basics. This is if you choose to go Route 1 with Original Medicare. So Medigap policies. These are optional, standardized policies that are sold by private insurance companies, but they follow certain federal and state laws. In addition to following those certain federal and state laws, all of these plans of the same letter have the same coverage. Only the costs are different. Now, not all Medigap policies are going to be offered to people under 65 with a disability, and you will have to pay a premium in addition to your Medicare Part B premium. But you cannot have a Medicare Advantage plan and a Medigap policy at the same time. Medigap plans are standardized plans that cover basic and/or additional benefits. You can see that this chart here shows you the Medigap plans through letters. The plans are A through D, F, G, and K through N, with each of them having their own set of covered benefits. Now keep in mind that the plans that have out-of-pocket limits are K and L, and for 2023, those numbers are set here on this slide: $6,940 for Plan K, $3,470 for Plan N. These will change each year. I'd also like to make note that for those of you who are new to Medicare as of January 1st, 2020 or later, Medigap plans C and F are no longer being sold. Your options are going to be now D or G, respectively. This is because they wanted to level the playing field, per se, and there were no longer going to be any plans that were going to offer coverage for that Part B deductible. So these Medigap policies, for the most part, are going to all kick in after the Medicare Part B annual deductible has been met. Now, at the basic level of coverage, this is a minimum. These Medigap policies are all expected to cover the Medicare Part A and B coinsurances and copayments, the Part A hospice care, the first 3 pints of blood if a transfusion is needed, and plans that offer coverage of both basic and additional coverage will all offer the basic plan features, including skilled nursing facility care coinsurances, Part A deductible, and then they'll go up more depending on the plan. Plans with the same letter must provide the same basic benefits. The cost can vary greatly between the companies, but that's because it's how the premiums are determined that's going to be different. The cost of a policy can also vary based on zip code, age, gender, smoker, non-smoker, health history, the company selling the policy, and of course when you purchase the policy. Now let's take a look at the Medigap pricing methods. So for pricing methods, you've got 3 different types. The first is community rated, meaning that the price for the monthly premium is the same across the board to every policyholder in the community rated plan regardless of their age. That means for you that the premiums are going to stay the same no matter how old you are, and that they're only going to go up because of inflation and other factors. The second pricing method is issue age rated, meaning that the monthly premium is based on your age when you bought or were issued the Medigap policy. What this means for you is that the premiums are lower for younger buyers, and they won't really change as you get older except because of inflation and other factors. Ultimately, though, not the least expensive option in picking out your Medigap pricing policies. The third pricing method is the attained age rating, meaning the monthly premium price is based on your current age, and the premium's going to go up as you get older, and not just based off of inflation. So you will have inflation factoring in there as well. That means for you, the premiums are lower when you're a younger buyer. They will continue to go up as you get older, and eventually they're going to become the most expensive. Premiums are going to go up because of inflation and your age and potentially other factors. So if the monthly premium is affordable, purchasing a Medigap policy can be very beneficial. It's going to help cover the gaps in Medicare. That's the Medicare 20% coinsurance, minimizing your out-of-pocket costs. It's going to cover some of those copayments and more. And it's going to help in prevention of future catastrophic out-of-pocket coverage. Some of these plans are also going to help with some of the extra benefits, like offering maybe dental, vision, and hearing discount programs or their own policies. Now let's take a look at buying a Medigap policy. Now, the best time to buy a Medigap policy is when you first become eligible for Part B. We call that your Medigap open enrollment period. And during that point in time, when you purchase a Medigap policy, the insurance company cannot deny you the coverage. They can't place conditions on the policy like when it's going to start, making you wait for that coverage to begin, and they can't change the pricing of a Medigap policy because of your past or present health conditions. Now, there are other times you may be wanting to purchase a Medigap policy, and if you have a guarantee issue right, then it may not be a bad idea. Guarantee issue rights is the rights that a beneficiary has in certain situations when insurance companies are required by law to sell or offer a beneficiary a Medigap policy. In these situations, the insurance company must sell a beneficiary the Medigap policy, must cover all pre-existing health conditions, and cannot charge more for a Medigap policy because of past or present health problems. So how do you buy one? Well, you can contact the plan directly to enroll, or a MAP counselor can provide assistance with an online application only for certain plans, and that's those that offer that online enrollment option. So AARP, United Healthcare, Blue Cross Blue Shield, Priority Health, or Humana. But MAP can also provide you the Medicare Medigap policy comparison to really help you decide what plan will be best for you. So there's some things that people love about Medigap policies, and there's some things that they really don't like about Medigap policies. The things that they really like is that it's easy to comparison shop. It's really just about the price. There are lots of companies to choose from, and it provides a nationwide network of providers for anyone who accepts Medicare. So it really eliminates that lack of autonomy when it comes to picking your providers. You have the option to stay with who you've been with if that's where you want to be, and you don't have to worry about whether they're in network or not. It also helps to minimize and eliminate out-of-pocket expenses that you may end up paying, like, copays, co-insurances. But the things that they really don't like about Medigap policies is it's not easy to change your plan or your company after your Medigap initial enrollment period ends. There's really no annual open enrollment period, which then presents the opportunity for these companies to assess medical underwriting. And in most cases, policies use attained age-rated premium methodologies, which means that they're going to increase their premiums each year based off of age and inflation or other factors. And the expense, combining your Part B and your Part D and a Medigap policy, that's 3 monthly payments that you have to make then for coverage. And that's 3 different cards to provide at different locations. Now let's take a look at the Medicare Advantage plans. So Medicare Advantage, again, is referred to as Part C. This is a second way to get your Medicare coverage. It's a hybrid of original Medicare and Part D, and even some gap coverage. These health plan options are approved by Medicare. They are run by private insurance companies, but they are going to use specific networks of providers. They are going to be HMOs or PPOs. They may be an HMO point of service, but they're not going to be available in all areas either. Now, Medicare Advantage plans are still a part of Medicare, so you're going to get all of those rights and protections. You're still going to have the Part A and B covered services, but your deductibles, your co-insurances, your co-payments, that cost sharing, that's what's going to be different from the original Medicare. And it's also going to vary between the different Medicare Advantage plans. Most of these plans do include prescription drug coverage. Some may include extra benefits like dental, vision, or hearing. But you do still have to continue paying your Part B premium. And if you elect to have a plan that has a monthly premium, you may now also have the additional expense of that monthly premium each month. So how do you enroll in a Medicare Advantage plan? Well, you can join a Medicare Advantage plan when you first become eligible for Medicare during your initial enrollment period. That's going to begin 3 months before you turn 65 or are entitled to your Medicare from disability. It's going to be the month that you turn 65 or the 25th month of disability, and it's going to continue for at least 3 months after that. Now you can change your plans during the annual open enrollment period each year, October 15th through December 7th. Any enrollment changes you make during that time frame will begin January 1st the following year. And then January 1st through March 31st, if you are already enrolled in a Medicare Advantage plan at that time, you can also make changes during that time frame as well. And there may be other special times during the year that you're able to make changes. Those would be a special enrollment period. And there are quite a few of those. So if you're not sure, or if you want to know if you're entitled to one, give MMAP a call. Our counselors can definitely walk through that with you. So the best way to enroll in a Medicare Advantage plan, just like the Medigaps, you can always contact the plan directly to enroll. You can enroll yourself through Medicare's website, which is medicare.gov. Or if you really want assistance navigating the system, trying to find the plan that might be best for you, making sure that you've crossed all of your T's and dotted all your I's, you can give MAP a call for more assistance. We can help you walk through and compare those plans, and can also help you with an enrollment. So again, how do you investigate your Medicare Advantage plans? Consult your various resources. You have options of the Medicare and You handbook, medicare.gov. Again, it's going to compare the plans that are available to you in your zip code area. It's going to take a look at the cost projection, provide plan contact information directly. You've got access to the provider websites. You've also got access to MAP counselors. Again, we are going to help you make sure that you're going to get all of your desired health care in the process of comparison and enrollment. But before you do make an enrollment, just make sure that you check to make sure that your providers are in network. You definitely want to be in a plan where you can for sure see the doctors you like. The best way to do that is contacting your provider's office directly and contacting the plan directly to confirm. So there are things that people love about Medicare Advantage plans and things that they don't, similarly to the Medigap policies. So the things that people really like about Medicare Advantage plans, there's flexibility in changing your plans annually without obstacles like medical underwriting. Most of these plans use community rating, so it removes that age as a direct factor in determining annual premium increases. It can oftentimes be more affordable, especially for those that are relatively healthy, because the premium cost. And, the extra benefits like dental, vision, and hearing, those are available in most plans, and a lot of folks really want that coverage. And then there's simplicity. You're only paying one premium to one single entity. Now, what people really don't care for about the Medicare Advantage plans is, first and foremost, you've got limitations on your network providers. There's also the risk of several thousands of dollars based on the annual out-of-pocket expense. Those are at a minimum $4,000 and up. And it's a little harder to comparison shop because you got to look at the extra benefits that each plan is offering now. And some of these plans, they're offering anything and everything to get folks to enroll. So it's definitely important to really look at everything that is important to you when making a decision to enroll. Now, regardless of whether you go Medigap or Medicare Advantage, you have Medicare Wellness and Preventative Services available to you. These are services covered by Medicare Part B, and it, again, doesn't matter whether you're doing original Medicare with the Medigap policy or Medicare Advantage plan. These preventative services are the best way to find problems early and get treatment when it's going to work best. With original Medicare, you're going to pay nothing for most preventative services from a provider that accepts the assignment to Medicare. The co-insurances, if you have a Medigap policy that covers those Part B co-insurances or the Part A co-insurances, it's going to cover those office visits. Now, if you choose to visit a provider who does not accept assignment to Medicare and you don't have a Medigap policy that covers those excess charges, you may end up paying more. But with a Medicare Advantage plan, you're going to pay whatever the designated copayment cost sharing is. Now, all new to Medicare individuals are entitled to a Welcome to Medicare visit with their doctor. This is a great way to get up to date on important screenings and shots and to review your medical history. The Welcome to Medicare visit is only offered within the first 12 months of getting Medicare Part B, regardless of MA or Medigap. During this exam, the doctor is going to review your medical and social history, your height, your weight, your body mass index, simple vision testing. They'll go through education and counseling with you, and they may refer you for additional screenings. But they'll be able to really give you that information, that written plan, the checklist, letting you know where you're at and what's going to take place over the coming years for your medical treatments. And then every 12 months after that point, you're also entitled to a yearly wellness visit. Again, similar thing, you'll sit down with your doctor, you'll go over those blood pressure, height, weight measurements, your preventative plan, your screening schedules, the health advice that they have just for you, and any referrals for your health education and preventative services. Now, your Welcome to Medicare visit and your yearly wellness visit are covered at no cost to you as long as you are seeing a in-network provider and have your coverage with you, your cards with you. Now, for those with Medicare Advantage, you may have to pay for an office visit, but not the exam itself. There's also other services aside from the Welcome to Medicare visit and the yearly Medicare visit that Medicare does cover. So you can see here that we've got access to cardiovascular screenings, mammograms, prostate cancer screenings, flu shots, pneumonia shots, bone mass measurements, glaucoma testing, diabetes screenings, PAPs, HIV screenings, COVID screenings, and COVID vaccines. You also have access to the shingles vaccine and the DTaps. That's the tetanus, diphtheria, whooping cough vaccines. Now we're going to talk just a quick word here about Medicare fraud and abuse. Medicare fraud is the most common scheme that affects seniors and Medicare beneficiaries. It can be as simple as Medicare or Medicaid being billed for services that you never got, or equipment that you never received, or equipment that you returned. If someone else is using your Medicare or Medicaid, if a company uses false information to mislead you into joining their plan, or even now we've got folks that are using the Welcome to Medicare and yearly wellness visits as a scam. They're third-party health care services that are trying to help you by doing your yearly wellness or Welcome to Medicare visit and save you the visit to the doctor's office because they'll send that information to your doctor. But that's not what those are meant for. These are intended for you to visit with your primary care physician and discuss what your health is going to look like and what it needs to be at. And these scammers are, because these services are free to you, getting paid the money that your doctor should be getting paid and abusing the Medicare system and not actually providing you the service, which is, again, that conversation about your health care with your primary care physician. So if you or anyone you know has had any issues like this, let MAP know. We can help report these scams and get them under wraps. So the question of the day, which is better, Medicare Advantage or Medigap? Well, that answer depends on several individual factors, including geographic mobility, the need to use specific healthcare providers, financial resources, comfort level with out-of-pocket expenses, the risk of your health status. So MAP is here to help. If you want to speak to a specific counselor about your situation, give us a call. We are currently counseling over phone, through Zoom, and in person where available. And our services, they're confidential and unbiased. There is no question too trivial, and we often deal with the very complicated as well. And for resources outside of MAP, you do have access to the Medicare and You handbook. You have access to Medicare.gov, which is Medicare's plan finder and website, and of course, you've got 1-800-Medicare. But for your best resource for all local Medicare information, that's going to be MAP. Our services are free, they're unbiased, our certified counselors are not sales agents, and we're not affiliated with private insurance companies. We will be your best resource for all questions and concerns Medicare. Again, no question is too small or too difficult, and we've saved over $2 million for beneficiaries in your area. So give MAP a call, 800-803-7174. And just a quick funding statement from our funders, the State Health Insurance Program and Senior Medicare Patrols. We're supported by grants from the U.S. Administration of Community Living and the Department of Health and Human Services. Points of view expressed do not necessarily represent the Administration for Community Living or Department of Health and Human Services, including MDHHS. MAP does not receive funding from, nor is it affiliated with any insurance company. And if you have any questions, please feel free to reach out to me directly. Again, my name is Melissa Devine. My email address is here, and it is mdevine@aaa1b.org. Thank you so much for spending your time with me. You have a wonderful day.